Welcome back to Hersco Online, your online resource for tricks and tips on custom foot orthotics, AFOs, Ritchie braces, ankle gauntlets, and custom molded shoes. In this section, we'll take a look at custom molded shoe design. The first criteria for a custom molded shoe is to consider what height the shoe should be. I generally like to look at the patient as they come into the examination room and see what they're wearing at the moment. Often this can be disappointing. They may be wearing slippers, or they may be very active and they could be wearing boots. You want to begin to use that as your first gauge to decide the height of the shoe. Low top shoes are easier to put on and take off, so most patients prefer those. However, if they have unstable ankles or if they're wearing devices such as AFOs, they will definitely need at least a chukka height and possibly a high top shoe. Having chosen the appropriate height of the shoe, we need to consider the opening. The shoe opening determines where the vamp ends and where the quarters are joined together. A semi-surgical opening typically has the eyelets going down across the metatarsal heads. A surgical opening will extend this even further so that the eyelets go almost to over the toes. Surgical shoes tend to look a little more orthopedic or medical, so patients don't necessarily want to wear them. However, if the patient has a rigid ankle or if they're wearing an AFO, then it's better that they have a surgical opening. They have a wider throat and more room to get the foot inside the shoe. You then need to choose the closure. The options are generally laces or Velcro. Laces are standard, they tend to look less orthopedic, and they give good control and seat the tongue and the vamp well around the patient's foot. Velcro can be very helpful in cases where the patient has poor control and manipulation of their hands. Looking at the cast modifications, there are several choices here, such as the toe box height. This will allow for hammer toes to be placed inside the shoe without causing irritation on the top of the toe itself. A snug heel fit is a great way to accommodate a foot that's wide in the forefoot but narrow in the heel. It will help the foot to stay better seated inside the shoe. Extra toe elongation can be requested if you notice that the cast of the patient's foot tends to be a little short, especially in comparison to when they're standing full weight bearing. One excellent way to note this is to see the patient's foot and trace it while they're seated, and then have them stand full weight bearing and see if there's an extension of the toes in that position. Ultimately, the shoe last needs to be made to accommodate the patient's foot in full weight bearing stance. There are several options for the insole of the shoe. It's possible to get a plastizote, and that has been the most common type prescribed, especially since these shoes are typically provided for Medicare diabetics. Typical insole there will be multi-layered plastizote with an EVA base cover, and that must meet certain Medicare requirements. However, if the patient is not a diabetic and you'd like a more durable insole, it's possible to have them made out of EVAs or corks. Moving on to the outsole, you may want to consider several options there to improve the function of the shoe. One of those can be to have a rocker put onto the shoe to aid in ambulation. This is a good idea if the patient has a fixed ankle, perhaps they've had an arthrodesis, or if they're wearing a solid ankle AFO. You may also want it in a case where you want to relieve pressure off the forefoot for a patient. There are other options for the outsole, including the use of flares and wedges, where you can essentially balance or post the shoe at certain angles to help the patient's function and their stability. Sole stiffeners can be made from steel shanks inserted into the midsole of the shoe, or you can just use a thin carbon plate underneath the insole. Quite often, these patients that require custom molded shoes will need some lifts. There are several considerations for lifts. First of all, it's important that you yourself measure what you feel is the appropriate amount of a lift. If you measure that the patient needs a 2-inch lift, you may want to approach that in stages and gradually get them used to the idea of having a rebalancing occurring on their lower limb. Patients tend to prefer the lifts inside the shoe because they're more cosmetically appealing and there's less difference visually from the outside of the shoe. However, in order to give yourself some room to play with the shoe if it needs to be rebalanced going forward, it's often best to split the lift, possibly 50% inside and 50% outside. These are just some of the considerations when you're designing custom molded shoes. For further thoughts and for a larger discussion of this subject, please go to our website, hersco.com, and click on the Education tab. There are several articles that discuss the design criteria for custom molded shoes, and you can always call the lab and speak to a certified podorsist if you have specific questions. Thank you once again for joining us at Hersco Online.